And welcome to the fourth part of our five-part series on our pillars of fitness. My name is Craig Cole, and today we're going to be talking about body composition. Now, when we think body composition, most oftentimes we think about just our overall weight. But we're also going to learn that it involves the size and shape of our body and the various components that are within our body that make up our overall mass. We're going to be discussing some ways that we can reduce down our body composition. We're going to be discussing some exercise protocols that can help us basically have a morphological change of our body composition and how we can work on essentially having an overall healthier lifestyle. With body composition, sometimes it can be a terminology that can be a little misunderstood. We know that the human body comes in a variety of sizes and shapes as it grows from infancy through to adulthood. You can look at somebody who may be of the same gender, height, and weight as yourself, but they could have a very drastic body composition difference than you. Usually when we look at body composition, we always think about weight. And weight usually depends on the quantity and the quality that exists within the body. And this can be the amount of lean muscle tissue you have, the amount of water retention you have, the amount of adipose tissue that you may be carrying. But we also have some other factors that can be involved too, such as an individual who may be suffering from osteoporosis. The osteoporosis itself can actually disrupt the overall weight of bone because osteoporosis causes bone to be more porous. And when it becomes more porous, the density of it reduces down, which therefore reduces its overall weight. We can have an individual who may be working out in the gym and they're working on developing more lean muscle tissue. As they're sitting there working out and they're working on their strength training, they're going to be developing where their muscles grow and hypertrophy. Now you can also have in turn where a person is at home, they may not be doing a whole lot and their muscles will actually start to atrophy down, and that means they start to be losing muscle mass. And when they lose muscle mass, that in its own right can reduce their overall weight. But then we also have it where an individual can be working on losing body fat. They're again starting to get themselves into a gym and they're starting to work out and they're starting to slim down, losing that overall body fat. But then again, you can also have an individual who may be a little bit more lethargic and maybe not be as motivated to be active, and then they start putting on adipose tissue, which is increasing their overall weight. So again, body composition is something that can be a little bit confusing depending on a person's activity levels and their different percentages of again, fat, bone, and muscle within the body. With having a better understanding about what body composition is and how different body types and sizes all can have comparatively different body composition rates, we're going to be talking a little bit more about energy balance and what that means in regards to our overall body composition. So when we think about energy, energy is something that is derived from the amount of food and drink that we consume. And the energy is something that our body utilizes in various ways throughout a given day. And this can be through its own natural metabolic processes. It can be through different types of physical activity, running, jogging, weightlifting. But all these different processes that occur throughout a given day are known as our total energy expenditure. And this is something that is the overall accumulation of energy and how it is used throughout the day. Now we have something else called resting energy expenditure, which is a very large component of energy expenditure as all these metabolic processes occur to our body while they're at rest. So even when your body is asleep, it doesn't mean that your body is actually turned off. We have various metabolic processes that allow our heart to beat, our bodies to breathe, for oxygen to flow throughout our bodies. Sometimes we move in our sleep when we get into a deep REM cycle. And all these different aspects occur during our resting energy expenditure, just while our body's at rest. Now, we're going to talk a little bit about three different scenarios when it comes to energy in and energy out. As you can see, I've got listed out 3 times composites of energy in and energy out. But our first one talks about the energy out being less than what was ingested. And what this means is we're not burning the same number of calories that we had just ingested. We're actually expending less. So what ends up happening with this, we have a surplus of energy that occurs in our bodies, which actually equates to weight gain. We actually have a higher number of calories that we hold in surplus, and our body metabolizes that into fat, which then becomes excess weight. Now our energy out is more than what we had ingested, and this means that the amount of energy that we had just consumed, our physical activity had allowed us to burn off more calories than we had consumed. And this helps us have a weight loss that occurs, or a negative energy balance. Now, if our energy that we consume in equals the energy that we expel out, no weight change occurs. The amount of energy we bring in and the amount of energy that we expend basically balance each other out, so we don't have any net change. But it's important to understand that our total energy expenditure is affected by a couple of main things here. It's affected by our physical activity, the actual overall thermic effect of food, how we go about our food digestion. Are we able to digest our food quickly or slowly? But then also our resting energy expenditure. But there's two components of resting energy expenditure that stand out for our total energy expenditure, and that is the amount of lean muscle that we have, but then also the amount of fat mass that we have on our frames. The more lean tissue that a person has, the more calories that they're going to be able to burn while they're at rest. And this goes directly back into that concept of total, or the resting energy expenditure. And again, the more lean muscle tissue that a person has, it helps along with their metabolic processes to burn more calories while the body is inactive. In order to understand our body composition a little bit further, we also have to understand that there's certain measurements that go along with it as well. And some common ways of measuring our overall body composition is to do something called a skin fold test, a bioelectrical impedance analysis, body mass index tests, waist circumference tests, and then hip to waist ratio tests. We're going to focus on the tests that are relatively easily administered. In discussing the various techniques and devices that are available to help us capture our body composition a little bit better, we're going to be talking about one of the first ones here, and that's bioelectrical impedance analysis, or BIA for short. BIA uses a weak electrical current that gets sent throughout our body. So what happens is, as the current is sent throughout our body, tissues with reduced water content, such as bone and fat, actually end up slowing the current down. This means that fat has a high resistance to electrical flow from the BIA device. This reduces the frequency signal that gets sent for high impedance readings back to the device. The BIA device monitors any type of reduction current. There's a number of different calculations that are available within the device to help us determine the difference between fat-free mass and then also body mass. The BIA device helps give an idea of body composition with some standard error. Now, not all measurement devices are without fault. Now, the BIA device, one of its biggest downfalls sometimes can be the actual thickness of the person's skin. If a person's skin is too thick, there's not going to be enough voltage that's able to get through to the rest of the body, which will end up giving us not 100% accurate readings. Another type of measurement device that we use to determine body composition is something called body mass index. And body mass index, or BMI, is a measure of our weight in relation to our height. And we have different classifications that go along with our BMI, such as being underweight, having normal weight, being overweight, or even obese. Now, BMI can be calculated by two different methods. We can take our body weight, which we convert to kilograms, divided by our height, which is in meters squared. And this gives us our body mass index, which is stated as our kilograms times meters squared. Now, we have a second type of calculation, which is our body weight, which is measured in pounds, which is divided by our height, which is converted to inches squared, times 704.5, which again gives us our BMI value. Now, both of these calculations do have some standard error based upon our overall true body composition. This is just a mathematical calculation that is predominantly used in field tests for large groups who are generally considered to be obese. It's not a very accurate tool for those who are not truly considered to be obese. And the reason why is because you can have somebody who is highly athletic. They have very low body fat, a higher ratio of lean muscle tissue, and they may weigh the same as another individual who is considered to be sedentary and obese. And what ends up happening is that lean physical athlete may be put into the same risk classification, such as being obese, as the sedentary individual. So there is a little bit of erroneous data that can be collected from body mass indexes. So we have to understand when it comes to being overweight, obese, or are we truly overfat? We're going to go through each one of these as a definition to help clarify what each one of these truly means. So being overweight relates directly to our BMI value. It does not have to relate to any extra fat deposits on our bodies. Any additional muscle mass and greater bone density adds to the BMI value. And being overweight usually has a classification value of between 25 to 29.9 on the BMI scale. And this means that we're of fatness of moderate degree. Obesity directly relates to our BMI as well. And anytime we have a BMI value that is greater than 30, that means we have fatness of a severe degree. And this can mean that we have some direct health consequences that may be involved in it. The terminology of being overfat means that a person's weight is largely comprised of true body fat. And they may present as a healthy weight, but due to being sedentary, their body composition may be more fat than lean muscle tissue. Now, I have a couple of pictures here, and if you look to the top of the picture, we have one gentleman, and it's the same guy here. But in one picture, he is definitely overweight, and in one other picture, you can definitely tell that he has gone through some lifestyle changes to help reduce his body fat down and increase his overall lean muscle tissue. But again, this is where we're looking at the same individual and the same height, and quite honestly, he is of the same weight, but his body composition appearance is completely different. And again, in one picture, he is considered to be over fat. He has an excessive amount of body fat on his frame, but in the next picture over, he is actually considered to be obese because his body or his BMI value is actually at 32.3. And what this means is that even though he is of a healthy body now, he still has a classification of being obese from a clinical standpoint. The picture that is right below is the depiction of a young person who, again, they're not excessively overweight, but they do carry a lot more body fat on their frame than they do lean muscle tissue. And again, this is where we're looking at the concept of being over fat in relation to being of normal weight. Again, this is one of those downfalls of being sedentary where you're not really active, but again, you're also not putting on excessive amounts of fat through overconsumption of food. Our next two types of techniques that help us understand a little bit more about body composition are our waist circumference and hip and waist ratio. Our waist circumference can help us understand a little bit more about any types of health risks that we may be potentially incurring. And what ends up happening that causes an elevation in our health risks is we know that anytime a waist circumference goes higher than 40 inches in men and also higher than 35 inches in women, we increase our overall health risks, whether it be cardiovascular disease, hypertension, or any type of metabolic syndrome. And when we take our waist circumference, we're actually taking that measurement starting about 2 inches below our belly button and then wrapping it directly around our waist, pulling it firmly, but not so firm that we actually start to deform the skin itself. For our hip and waist ratio, we're looking at how body fat distribution can determine certain types of health risks that might be present with something called central obesity. And central obesity is the overall fat accumulation that happens around our abdomen. Now, central obesity has normally been linked with higher risks of hypertension, metabolic syndromes, type 2 diabetes, and cardiovascular disease just like some of the risk factors that go along with increased waist circumference. Now again, when we're looking at the hip and waist ratio, again, we're still taking that same measurement around our waist, again, starting at 2 inches below the belly button, and then firmly wrapping the tape measure around the waist. But when it comes to the hip, we want to make sure that we take a measurement value directly around the widest part of the hip itself. We don't want to take it at its narrowest part, because again, that's not going to give us a very good accurate measurement. But once we obtain the waist and hip values, we're going to take the hip circumference and divide that by our waist circumference to get that waist to hip ratio value. On our next slide, we're going to be talking about what some of those values truly represent and what numbers we're going to be looking at to determine what kind of classification we may be. So when we look at our waist and we're looking at our BMI values, we're going to start talking about our BMI value first. And our BMI, anytime that it runs below 18.5, we are considered to be underweight. Now, normally speaking, that's not necessarily a bad thing. If that BMI value starts to become too low, anything below 15, then we sometimes have to look to see if the person may have a challenge with being malnourished. If we're looking at values of 18.5 to 24.9, normally we're at a normal BMI or a normal healthy weight, excuse me. But then if we're looking at values of 25 to 29.9, we're starting to look at classification of being overweight. And again, this is where we start getting into the danger territory of starting to have certain risk factors associated with our health. Now, anytime that we have a BMI that goes above 30, we start going into different classifications for overall obesity. We have classifications 1, 2, and 3. So class 1 is any value that is 30 to 34.9. Class 2 obesity is 35 to 39.9. And class 3 obesity, which is considered to be severe obesity, is anything with a BMI value above 40. And again, this is one of those things that the BMI value is more accurate for individuals who are already considered to be obese versus an individual who may be highly muscular and athletic by nature. Now, as we're talking about when we're looking at our waist circumference can also dictate certain types of risk factors for us as well. Again, a healthy waist circumference for men is anything that falls below 40 inches. And in women, it's anything that falls below 35 inches. So quite honestly, if your waist circumference is below 35 in women and below 40 in men, you're technically considered to be of a normal weight. Now, once you start getting into be where it hits 40 and 35 respectively, that's when you start having where you can be certain classified as overweight. Now, we also have it where if that waist circumference starts to go up significantly higher, then you can start having where, again, you start falling into the line of obesity. So higher BMI values for most individuals tend to lead to more health-related concerns. Usually weight challenges that are pretty severe present the risk factors for diabetes, heart disease, hypertension, kidney disease, but then also certain types of cancers. So that's one of the reasons why we look at these as risk stratifications, because we always want to look to see if there's an opportunity to be premature on some type of intervention to help reduce that waistline down, as well as to hopefully drop overall body fat, reducing that BMI value down as well. Now I've been talking about some of the devices and techniques to help us understand our body weight and what that may end up entailing for certain risks for our health. We're going to be talking a little bit more about energy and how we can actually maintain our current body weight. We're going to be utilizing something called an estimated energy requirement, which is actually a calculation that's used for both men and women. Now, in our graphic here, you're going to see something called the physical activity factor for the EER equations. And basically what these are different activity levels with a clinically derived value that we're going to be plugging into an equation. So what you do is you look at this and you determine whether you're sedentary, low active, relatively active, or very active. And you're going to take that value and you're going to help plug it into the equation. So we're looking at this for men. We're going to be taking an equation starting out at 662 minus 9.53, multiplying it by your age plus your physical activity factor value times the summation of 15.91 times your current weight plus 539.6 times your height. You put all that into the equation and that'll give you your estimated energy requirement to maintain your current weight that you have right now. Now for women, the calculation is going to be 354 minus 6.91 times age, plus again your physical activity value, times the summation of 9.36 times your current weight, plus 726 times your height. Now it's important to know that within this equation, we're going to have to take your weight and convert it to kilograms, and your height convert it to meters. In order to convert pounds to kilograms, you're going to have to take your current weight in pounds and divide it by 2.2. And then for your height, we're going to convert that not in feet, but convert it all into inches. And then divide the inches value by 39.37 to give you your height in meters. So once we do this, this will help give you a better understanding as to how much energy you truly need to maintain your current weight throughout the given day. We're going to broach the topic of energy consumption and what that actually means for us. Now, energy is something that comes from macronutrients in the forms of carbohydrates, fats, and proteins. And all three of these macronutrients are essential for everyday body function. But all these macronutrients also entail something called calories. And calories are a measurable form of energy that are derived from our different types of foods and drinks that we consume. Now, if we overconsume with this energy and we introduce it to the body, the fat tissue is going to accept it and actually enlarge due to the overconsumption. And again, this is where we start putting on that excess fat tissue, that excess adipose tissue. Now, for every 1 pound of body weight, that's the equivalent to 3,500 calories. And if you're a person who needs to do any type of dieting and you're trying to actually lose 1 pound of body weight, well, you're going to have to learn how to lose about 3,500 calories through either diet and exercise. Now, energy is usually expended through our basic metabolism and physical activity. And the calories that we burn through physical activity usually depend on the type of activity and the overall intensity of it. And this is why it's a very, very good idea that any type of exercise program that you're on, you want to make sure that you are challenging yourself, that you want to make sure that you are sweating, that you are breathing a little bit heavier, all within reason, because you are then going to be working on expending excess calories and again trying to get to that 1 pound of body weight loss. Now, the excess calories that definitely go unused convert immediately to fat in the body. If there's a surplus every single time that we eat a meal, our body is going to only use a certain amount of it if we're not active enough. And what ends up happening is if we leave all that excess energy that's been unused sitting within our body, well, it's going to get converted to fat. And it's important to know that all those macronutrients, the proteins, the carbohydrates, the fats, they truly are building blocks for different types of calories. And what this means is that not only do they help with our overall metabolic processes, keep our heart going, keep our muscles strong, give us clarity of thought and energy, but it's one of those things where they are something that can be converted into fat quite readily. Again, if they're not used and expended as soon as they're basically consumed, our body's going to retain them. So going into the concept of our macronutrients a little bit more, we're going to talk about how they help us with our strength, endurance, weight loss, gain, as well as the recovery. Now, the United States Department of Agriculture has certain guidelines that suggest macronutrient consumption based upon daily values or ratios. When we look at our carbohydrates, we're going to see that they help provide energy for higher intensity exercise. And usually our carbohydrates are the first go-to energy source when we get involved in any type of high intensity movements, such as running, jumping, or any type of high intensity interval training. And 1 gram of carbohydrate, if you look at the dietary guidelines on any of your nutrition packages on your foods at home, 1 gram of carbohydrate is the equivalent to 4 calories. So in order to reduce our body fat, we need to have a calorie consisting of 45 to 50% of our carbohydrates. For our proteins help rebuild muscle and other bodily tissue. 1 gram of protein is also the equivalent of 4 calories. Now, in order to reduce our body fat, we want to have it where our calories overall consist of 25 to 30% of proteins daily. And then for our fats also act as an energy source. And 1 gram of fat is actually the equivalent to 9 calories. So it has a higher energy total than our proteins and our carbohydrates. But in order to reduce our body fat, we want to have a diet consisting of 20 to 25% of body fats. Now, with our macronutrients and their intakes, they're strongly influenced by about how our body responds. For those that are generally more active, higher protein and carbohydrate intakes may be actually necessary. They help fuel the body better. For those looking to put on more muscle mass, higher concentrations of protein and reduced carbohydrate and fat intakes may be more appropriate. So again, the macronutrient intake, your dietary means, plays a big role in what you want for your body composition to overall be. When we look at composition strategies, and composition strategies are what we can do to actually control and help maintain our body composition, is we need to look at how you can control your dailies, set goals for your weight, get started on exercise, as well as also review your types of medications. Now, we can talk about controlling your dailies. What that basically means is that eating at a fast food restaurant is something you should do sparingly. You need to take note of any type of bad habits that you do have or any types of nutritional trends that can sabotage your newer healthy lifestyle. You also need to try to make sure that you try to cleanse your day of any types of processed junk foods. And that means that if you're an individual who you're at lunch and you need a quick snack, you say, oh, those M&Ms sound really, really good right now, that may be something that you need to start paying attention to a little bit more, because if you eat that bag of M&Ms at lunch and you go back to sitting at your desk, well, guess what? That refined sugar that's sitting within that candy, your body's going to convert to fat very quickly. When it comes to setting your goals, we also need to define what a target goal is. You know, if you are sitting there and you are just a couple of pounds of being overweight, do you need to take any drastic measures? No, you do not. But what you do need to do is you need to understand where you want an ideal target weight to be. And a good idea is to talk with your doctor about what an approximate weight that's appropriate for you may be. It's also a good idea that when you're thinking about setting type of weight goals is research what type of healthier foods are out there to help you achieve your goal. Another key strategy is getting started on any type of exercise. And getting started on strength training, aerobic training, flexibility training as a means of helping you maintain your weight is very, very important. But the bottom line is anytime you can find an exercise program that you enjoy and that actually does challenge you physically is a great thing to do. But something that is often overlooked is reviewing your medications. A lot of times when we are looking at our weight and our body composition, we are always looking usually at our food and nutrition intake as well as our physical activity levels. But oftentimes medications get overlooked. If you're having any type of water retention, or you are having where your medication may be having you have more cravings for food, causing you to overeat, it's important to discuss with your doctor adjusting your medications or any concerns that your medication may be bringing to you. Now we're going to go from talking about dietary calculations and what body composition means Now we're going to be talking a little bit more about an exercise strategy. Now, the American College of Sports Medicine has several exercise protocols that exist that actually have clinical relevancy. And these different protocols help with us to maintain and change our body composition. Now, if we're looking at aerobic training is designed to elevate the heart rate and also something called our perspiration rate. And perspiration rate is where we basically start breathing faster while we're engaged in some type of physical activity that's challenging our body. Now, these two components actually help increase our calories being burned during, but then also post-exercise. Resistance training ends up building lean muscle tissue, which leads to more calories burned while at rest. That new lean muscle tissue is always going to be looking for a fuel source to maintain itself, and fat and our carbohydrates are great sources of energy for it. Now, a quick tip when it comes to having an exercise strategy for maintaining weight or weight loss or weight gain is always make sure that you begin your exercise session with a light warm-up with active movement. And generally this can be anywhere between 5 to 8 minutes. Now, sitting there standing in place and moving your arms up and down, that doesn't necessarily consist of a warm-up. That is more of an isolation-based movement. Going into a high knee march in place or a jog in place, or going through dynamic arm rotations forward and backwards, going into bodyweight squats, those all start to consist of what a warm-up really is. And if you can incorporate those movements during a 5 to 8 minute time span, you're going to be getting it to be where you get your muscles warmed up, you're going to be increasing your blood flow to your working muscle tissues, you're going to get your heart rate, your blood pressure elevated, and you're also going to increase your respiration rate. You're basically getting your body primed for movement. After warm-up, you want to progress to a strength training workout that focuses a lot on compound movements for both your lower and upper body. And generally speaking, you want to try to achieve about 30 to 35 minutes of strength training. And again, you want to maximize the amount of time because you want to have where you're maximizing your upper and lower body, performing movements such as squats, any types of presses, versus anything that's an isolation movement such as an arm curl or a lower leg extension. After you get done with your strength training, it's also a good idea to go ahead and select 1 or 2 pieces of aerobic exercise that you can complete for 20 to 30 minutes straight through. Now, when we're looking at aerobic exercise, walking and jogging outside are aerobic exercise. If you need to get on a treadmill or a bicycle inside, those are 2 other great pieces of aerobic equipment to use. But the idea is you want to have rhythmic, repetitive movement for the duration of 20 to 30 minutes, where again, you're increasing your heart rate, your respiration rate, which again is going to help you burn more calories. In order to complete your exercise session, you want to always make sure that you go through a cool down that consists of stretching your major muscle groups and getting, again, that heart rate to start coming back down, bringing your body back down to resting values essentially. And usually that can be accomplished in about 5 to 10 minutes. But again, having a good exercise strategy when you're looking to have any type of weight loss is very imperative. To clarify a little bit more about an exercise prescription or an exercise strategy, I'm going to be showing you a graphic from the American College of Sports Medicine's Guidelines for Exercise Testing and Prescription. And I'm going to be showing you this because it's the fit recommendations for weight loss. And this is a general guideline for individuals to maintain weight or to develop weight loss if it's absolutely necessary. Now, the FIT protocol stands for the frequency, intensity, time, and type. And what we're going to do is we're going to talk about that for the aerobic, resistance, as well as flexibility aspects of health. Now, the frequency for aerobic training is we want to try to maintain at least 3 to 5 days a week of some type of moderate to vigorous intensity exercise. Now, at base minimum, we want to try to have it where our aerobic training sessions are about 3 days a week. And we want to try to have it where we're maintaining vigorous intensity exercise during those sessions. Now, if we go 5 days a week or more, we want to drop that intensity level down to moderate. And the main reason why is because we're actually increasing the overall duration of our workouts throughout the week. We're increasing the overall frequency of our movements, and we don't want to have it where we risk any potential injury by always constantly exercising at a vigorous intensity. Now, one of the things that you can do is if you're working out 5 days a week and you're just really getting started on a program, you can moderate between moderate and vigorous intensity exercise and not have any too great of undue risk. Now, for the intensity of movement, this is something that needs a little bit more discussion. We always want to think about moderate to vigorous intensity exercise, and we always want to make sure that we're trying to progress from moderate to vigorous for most of our exercise sessions as our health starts to improve, our physical fitness starts to improve. But one of the big questions that starts to come up is, well, what is intensity? What does that mean for me? So what we're going to be looking at is one of two things. And I know a lot of people out there have the fitness watches that have the different heart rate zone monitorings that are on them, which is great. But a quick, easy way is to look at something called the Borg scale, or the rate of perceived exertion. Now, when we're looking at our rate of perceived exertion, this is a scale that goes from 6 to 20, and it has different categories depending upon how you feel with your movement. Now, when we're looking at moderate intensity exercise, we want to try to have it where the value ranges from essentially 11 up to 13, from fairly light to somewhat hard. We want you to make sure that you're understanding that you are putting some effort within your movement. Now, for the vigorous intensity exercise, we want to take that value of 13 and we can drive that all the way up to 16, where we're getting the understanding that the exercise that we're doing is actually pretty hard. It is challenging. So that's the type of intensity that we want to have from an aerobic standpoint. The amount of time that we invest into our aerobic workout is we want to try to have a base minimum of about 30 minutes per day, with trying to accumulate up to 150 minutes per week. Now, as our physical fitness starts to improve, we want to try to progress that 30 minutes up to 60 minutes per day of moderate intensity aerobic movement. Again, with vigorous intensity exercise, we want to make sure that that's only encouraged for those that are truly capable. If we're constantly trying to, again, do vigorous exercise every single session, you're going to burn yourself out, and again, you're going to run into some complications from it. Now, it's important to know that when it comes to aerobic training and the amount of time, when we think about that 30-minute time span, it doesn't always have to be a direct 30 minutes all or nothing. You can actually take that 30 minutes and split it up into either 3 10-minute sessions per day or 2 15-minute sessions per day, 15 minutes in the morning, 15 minutes in the late afternoon. And that is perfectly acceptable because it's all about the accumulation of time for an aerobic standpoint. And this is actually a pretty smart way to go for people who are relatively deconditioned. Now, the types of aerobic training that we're going to be talking about really promote the use of the large muscles within our body. So things such as walking, cycling, swimming are usually pretty easy calorie burning exercises. As you start to get, again, better shape, you can start to progress to jogging or running, using an upright elliptical, jumping on any type of rower. And those really help drive home good aerobic fitness. Now we're going to talk a little bit more about our resistance training. And with resistance training for weight loss, we want to try to achieve at least 2 days a week. And you can usually have a day of rest in between, but that kind of depends too a little bit on what your strength sessions consist of. If you do 1 day of lower body and then 1 day of upper body, you can actually go back-to-back days. But generally it's recommended, and this is something that I recommend, try to make sure you're doing a total body workout at least a couple times a week, and that's where each session incorporates both lower and upper body. You want to try to maximize as much whole body muscle tissue as you possibly can to help expend as much calorie burning as you possibly can. Generally speaking, when it comes to the intensity for resistance training, we want to try to have anywhere between 10 to 15 repetitions at a moderate intensity. And that is where we're looking at weights that you can complete through the duration of reps of 10 to 15. And that is usually pretty good for promoting lean muscle tissue, but then also promoting muscle endurance. Anywhere between 8 to 10 repetitions usually achieves a higher intensity because you're actually increasing the resistance for all of your movements. And that is one of the ways that when strength training, we can increase that overall resistance. But again, the whole entire idea with strength training is we want to try to increase our strength as well as our muscle endurance. When it comes to strength training, we also want to make sure that we're not always doing the exact same thing. It is okay to vary up between the 8 to 10 reps to the 10 to 15 reps, and you can do that every couple of weeks. Now, the amount of time that we put into our resistance training basically depends upon the individual and what type of exercises you're doing, the number of sets, as well as the number of repetitions that you're doing. Another key component too is the number of rest breaks that you take in between your sets as well as between your various exercises. I usually recommend for those that are trying to do any type of weight loss that you try to drop your rest periods down to no more than 30 seconds between sets, but then also exercises. You want to try to transition from one movement to the next relatively as quickly as possible. And this way you keep your heart rate up and you don't let your body start to come back down to any type of normal resting levels. Now again, for resistance training, the different types are, we want to try to make sure that our weight training is progressive. We don't want to always constantly lift the same weight. We don't want to do always the same number of sets and the same number of repetitions. We always want to try to progress what we're doing. And that's where we can start going from body weight movements to plate loaded movement or machine based movement. We can start doing different types of stair climbing and other strength activities that really start to use our major muscle groups. We want to try to push our strength levels as much as possible because again, the more lean muscle tissue we have in our body, the more calories that they're going to burn during, but then also post exercise. And the post exercise is the critical factor for weight loss. When it comes to flexibility, we want to try to do that after every single strength anaerobic session that we do. And the main reason why is because during aerobic or resistance training sessions, our muscles are going to get tight afterwards. And we want to make sure that our flexibility is at its maximum. We always want to try to stretch to the point of feeling a tightness or slight discomfort. We never want to stretch to the point of feeling pain. And we also want to make sure that the amount of time we put into a stretch is usually about 30 to 60 seconds. Generally, you want to hold a stretch for about 30 seconds. If you start going over 60 seconds, the muscles actually want to start responding. Now, you want to try to hold each stretch also through at least 2 to 4 set durations. And I know this can sometimes take a little bit of time, but if you give yourself about 5 to 8 minutes after an exercise session, flexibility is a great way to go through a cool down. Now again, when it comes to flexibility, any physical activity that maintains or increases your flexibility using slower movements that ends in a static stretch is pretty good for any type of muscle group rather than any type of rapid or ballistic type of stretching. And static stretching is where we get ourselves into a certain position and hold for that duration of 30 to 60 seconds. Ballistic movements tend to be a little bit more bouncing in nature, which if, again, a muscle is not actually warmed up, can actually cause micro tears in the muscle and reduce the performance or lead to greater trauma throughout your exercise session. In conclusion, we're going to be talking about some of the major talking points that we discussed previously throughout our presentation today. And when it comes to our unhealthy body composition, we need to understand that there's some major health implications that do go along with it. Being overweight does have risk factors such as cardiovascular disease, developing type 2 diabetes, having certain metabolic diseases that go along with it. But then there's other factors that can go along that we don't really think about too much. And those are things such as osteoarthritis of our joints and also the weakening of our bone structure that could actually cause certain bone fractures or microfractures, which can lead to greater complications within our skeletal system. We also want to make sure that when we're following a regular exercise routine, that we needed to take care of our heart, our lungs, and muscles, allowing for better energy enhancement, having better endurance and strength benefits from the program, but then also achieving better balance and coordination as well as weight management. We want to make sure that our regular exercise routine helps improve our overall quality of life and acts as an enhancement for us to help change and modify positively our body composition. Now, if you ever run into questions about your current weight and you have any concerns, it's always important that you talk with your physician about that. They can help you understand whether weight loss is definitely something that's recommended for you and help you determine some good goals to try to achieve for your weight loss journey. Now, it's also important to know that too, that when it comes to dieting, dieting depends on everyone's goals, and every human being that is out there responds to diets in various ways. It's imperative, and I can't emphasize that enough, to be careful of the fad diets that are out there, because quite honestly, they truly may not be appropriate for you. The people who came with the fad diets, they may have found something that ended up working for them, and it's getting touted as something that's going to work for everybody else, and that may honestly not be the case. The Atkins diet, for some people, when you're reducing the amount of carbohydrates and you're focusing more on your proteins and your fats, for some people, your body may not respond to that. Your body may respond to having a little bit more of an intake of carbohydrate as an energy source versus your fats and your proteins. So if a person's body gets onto a program like that, you can actually put on a lot more fat than you could of actually taking it off, and you can run into some major risk factors from that. It's always important to contact your doctor or truly, honestly, speak with a registered dietitian if you do need to have some type of dietary suggestions. Now, I would like to thank everybody for joining me for this topic of body composition, and I look forward to speaking with you during our last segment in the series, which is going to be on balance. And again, thank you for joining me.